Let's move the discussion to a real important topic, and that's managing ACA compliance. And joining us to talk about that is one of the leaders in the space, Kami Haynes with Tango Health. Kami, good morning.
Thanks. It's good to be here. Thanks for having me on.
Yeah, nice to have you on. Give us a little background for the audience that might not know Tango. Give a little background on Tango, please.
Yeah, absolutely. Tango specializes in ACA compliance services. We typically help companies that are 1,000 employees or up, pretty much because ACA compliance is really complicated, and those larger companies face even additional complications. Whether they have unions or multiple EINs, there's a lot of issues that they face. And what we found is that we work with our clients to do full outsourcing, because a lot of people, ACA compliance is so new. HR teams weren't prepared for this, and they're usually understaffed anyway. So we provide total outsourcing. We work with companies throughout the year to make sure they're tracking eligibility, affordability, and that they're ready when the time comes for reporting.
Well, Kami, it's I know you guys do good work, and it's very important right now. Particularly, we got a short-term deadline coming up, June 30th. Talk a little bit about this IRS deadline coming up.
Yeah, so we're coming up on the time to file with the IRS, and this is a pretty complicated. Everything with the ACA is complicated, but this is especially complicated. So what we're finding is that if you have 250 returns, you have to file electronically with the IRS. And the IRS has made this system really challenging. So there's multiple steps, and I'll kind of give you a highlight of those. Step one is you have to file with e-services, and those are web-based tools that the IRS uses for communication for different transactions. But there's a bunch of eligibility requirements that people have to get on there. So once you do get certified with e-services, then you have to apply for what's called a TCC code. So this is a transmission code. There's two different transmission codes that you have to get. You have to get one to just test the system, and then you have to get one for your actual transmission. And once you get the codes, then you do your test communication with the IRS's AIR system. It's AIR. There's a series of scenarios you have to pass that are like word problems, but you kind of have to be at the level of a software engineer to understand how to code in XML using all these crazy acronyms like SOAP, and it has to be NIST compliant and all this other stuff. I mean, most HR people would be completely clueless about this stuff because it's way beyond their skill level. So you have to go through this test situation and get approved. There's a document to support this that's like 24 pages long and reads like a coding manual. So then the final step is, okay, you've gone through all these hurdles. Now you can submit, and you wait for a response. And so at that point, the IRS gives you back one of three responses. There's accepted with errors, and then rejected. And you get back an XML-coded file, and you have to sift through that XML to find the errors and figure out how to fix them. And there's hundreds of error codes that are possible. So it's super complicated.
So are employers doing this transmission themselves, or are they turning to, organizations like yourself and outsourcing it to the Tango Health of the world?
We've done a couple of different webinar sessions, and I've talked to people at events when I'm out doing those. And different people are handling this in different ways. And as a rule, really nobody was prepared for how hard this was. And a lot of us kind of wait till the last minute. And this process, people are finding that transmission process, getting set up for it, can take anywhere from weeks to almost months. And so, people are really stuck in the process. So we did a webinar earlier this week, and I had somebody ask a question saying, we've requested our TCC code and haven't heard back. And I'm thinking, you got like 11 days. You haven't even gone through the testing process. So we also heard from people that some of them had hired a vendor thinking they were turnkey, and then that vendor came back and said, well, no, you have to go get the TCC code and you have to transmit. So they're scrambling to get that done. But I would say anybody who's trying to do it themselves, as I walk through that process, this is an investment in resources, whether you have that software engineer that's going to help you out. It's time, it's pulling together the data, and just the headaches are ridiculous.
Well, that's crazy. Ron?
Yeah, Kami, this is fascinating stuff, but it's very much in the weeds. Maybe for our audience out there, can you get a little bit more, when I used to have very complicated things to say, I hope this isn't taken the wrong way, but I'd say I got to be able to explain it to my mother, an 80-year-old mother, what I'm doing. what is it that your system is being compliant with? What are you submitting? What are the different tracks of submittals or reports that we're talking about here? I understand the process you went through is very complicated, and you really need the expertise like you have to do it. But what is the transmission all about?
Well, saying that you describe this to your 80-year-old mother, I mean, I don't know if you can explain anything about the ACA compliance process to your mom and have her get it, honestly.
That's well said, Jimmy.
To put it in total simple terms, and I'm thinking most of your audience will get it if I put it this way, the ACA, Affordable Care Act, it means that every person has to have insurance, so that's the employee mandate, and the employers also have to prove that they offered eligible employees coverage. So what that means is they've had to track employees all year long to determine if they worked enough hours to be eligible for insurance. All right, already there we kind of go into the weeds because we're talking about eligibility and words like that. But the bottom line is you got to track those hours. And then, we had deadlines that were originally in January, moved to March, that you had to send something to the employee. So if they were called upon to do so, they could prove, yes, I had coverage. And that's that 1095C form. All right, so that was the first step. And that took a lot of work just to get out. That was the first step. Then the second step is now reporting to the IRS. And what the IRS will do, they'll take, in very simple terms, you're sending every single one of those 1095Cs that you gave to your employees with kind of a cover sheet. And I always make the Office Space joke that this is your TPS cover sheet, But basically, you're getting this to the IRS to say, here's who I covered, and here's the backup showing that they were told they were covered. All right, so it can be reams and reams of data depending on the size of your company. If you're smaller, like these companies that are 250 employees or less, they can do this by paper and mail it into the IRS. But then they don't have the ability to check with the IRS, digitally to say, did you get it? How did I do? Does that break? Do you think your mom would get that one?
Yeah. So, let's see if I can get it. It's even harder to explain to me than it is to my mom, probably. So basically, what you're saying is that the Affordable Care Act has certain mandates. People have to have coverage, have to prove they have coverage. Employers have to prove they've offered it. And if they don't do the right things, either as an individual, I don't have coverage, I'm supposed to, or my employer hasn't offered me, or I think most people are getting to understand that, if when they're getting their hours cut back below 30 hours, that the employer's, getting into a situation where they don't have to offer their insurance. So people are getting less hours. So the employer, if they don't monitor this and then report properly, the employer could be subject to some big penalties. And as individuals could be subject to penalties as well. So that's what you're really trying to solve, right? You're trying to solve the problem of being in compliance so that these penalties, which can be very complicated to figure out because there's multiple different ways to determine full-time employees and part-time employees and all that. Your system is handling all that without people having to be lawyers themselves.
Absolutely. Yeah. When you start to think of all the different variables in there, and things get super complicated around the employees themselves. And like you referenced, there are some companies that have gotten in trouble for cutting employees' hours in order to not offer insurance. But there's penalties all through this process. You're right. And they can get up to, some places there are thresholds of $3 million, which is definitely not inconsequential. But we're talking to some people who were looking at fines in the hundreds of thousands of dollars. So I had somebody on a webinar the other day who was battling with this, and based on the size of her company, she was looking at over $325,000 in fines.
Right. Yeah. So I know you're selling your service. Go ahead, Doug.
No, wait, I was just going to say, so Kami, the end goal is helping the employers transmit and get approval from the IRS. I mean, that's the end goal right now on this current deadline.
That's the step we're at right now. That's correct. Yeah, and what the IRS does is they use this as a checking process. So they're kind of creating a loop here to see, what you sent the employee, what the employee claims on their taxes, and then, whether all of this comes together to create a circular reference to say, all right, the individual said they were covered, you say you covered them, and this shows what you sent to them to tell them they were covered. So it's making that reference so that they can see.
Kami, if we've got employers, as we do, listening on this program, and they're struggling with this, is it too late for them to reach out to somebody like yourself to help?
No, it's not too late. But what we're running up against at this point, is that you're going to probably be looking at some kind of penalties. Again, we are transmitting on behalf of our employers, so anybody who comes to us doesn't have to get a TCC code. But we're kind of at the point of we're going to have to take your word for what we're transmitting. For our customers, we've been working with them to get their data cleaned up, make sure it's scrubbed, minimizing those penalties. Somebody coming to us this late in the game, we can't vouch for that data. So we're going to be at the point where you can send me your stuff, we can try to transmit, we can try to parse through that, and you'll have somebody to hold your hand parsing through that. But we can't guarantee that what you've done so far this year is going to be accurate. We've been working with our clients over the course of the whole year to get stuff cleaned up.
Okay, got it.
So how accommodating is the IRS on this? When they have problems, how accommodating are they? How accommodating is the IRS on problems and issues that come up? So that, or do they just want penalties? I mean, obviously, it's a very complicated process, and there could be even disputes about whether there was an error or not. How is the IRS to work with?
Well, they're pretty much the law. They get to see how it is. And, accommodating and IRS don't usually go together. Those guys pretty much figure you're guilty until you prove yourself innocent. I think a good example of that is that, they're coming back to you and saying you have these errors and you have 60 days to correct and send us back. And it's not like they're going to negotiate with you on this. There's a couple of places where they've recognized there are things that are hard to fix. So, for example, matching names to Social Security numbers. If you hire somebody on and, they go through the process of showing their I-9 or their Social Security card, and then you go to file using the name and social that they gave you, if that doesn't match up and the system kicks it back, you've got a couple of opportunities to update that within that time window. But they have said if you check 3 times, you try to get the information from the employee and you can't, there's other options. So there's a little bit of wiggle room there, but it's not a lot. And that's one of the very few places that they'll wiggle.
Yeah. Gotcha. Kami, let's look beyond this. I mean, I think you've covered this pretty well about this current deadline and helping employers transition and challenge the IRS. So what's on the horizon next that employers need to be concerned about around HSA compliance and what you're helping your clients with right now?
So I think the key is that everybody's really been exhausted by this process. There's 3 main things that I think are really worrying people about ACA compliance. It's like one of them is I'm still in the middle of doing this. I'm trying to get a transmission done by the end of June. I'm working through corrections or whatever else. I'm worried about subsidy notices, so I'm still cranking through 2015 compliance and just trying to get that done. The people who've gotten over the finish line are just exhausted. This has been a nightmare for everybody, and they want to just go sit in a lounge chair on a beach someplace and not think about it. And then the other thing is people are worried about what does the election mean. You've got a lot of ruckus around what's going to happen next, and people are kind of hoping that if they put their head in the sand, the ACA is going to go away. But it's not. It's going to be a lot harder to uncouple because people like to have insurance. There have been a lot of articles written and studies showing that this is not going to be a simple thing to undo. And even if it gets undone, it's not going to get undone in time because you're still going to have to report for 2016. So I would just say that what people need to be looking at is not taking a break. They need to be continuing to work forward to, compliance for 2016. They need to be tracking eligibility. We're already at June. If there was someone that they should have offered coverage to in February, there's a monthly fine for not offering that coverage. And if they haven't been tracking eligibility and they missed it, they're in trouble. So people just need to not pause. It's not, I make an example of I'm not going to show up at my accountant on April 14th and try to get my taxes done in one day. This is a complicated thing. It's 10 times more, 100 times more complicated than my taxes. People need to be thinking about this now and planning for it so it's not so painful when January rolls around.
We got time for about one more question here, and Kami, I can't let you off the phone without talking about the Cadillac tax. And how are you advising your clients to deal with the potential of the upcoming Cadillac tax? I mean, I think some want to keep kicking the can down the road. So how are you advising it? What are you talking to your clients?
It is a great question, and people do wonder, is that may be one of the pieces of the ACA that goes away first. But I think that there's a good opportunity here with the Cadillac tax, especially for CFOs and CHROs, to look at the benefits that they're offering their employees and determine what's over that threshold or what's trending towards that threshold. And it gives them an opportunity to look at their overall offerings and find out, say, for example, high deductible plans are something that are really popular with people. How do you make your employee understand the value of that high deductible plan to them? And that's something we've worked with a number of customers on. Employees don't understand them, and they're not going to change. They've got that inertia to just sit in the PPO plan they're in. So you really have to educate them on what the change means for them, show them the value. And we've got some calculators that we've used, and we've seen that when people see that they're only going to save about $500 in that high deductible plan, it's not worth changing. But when they see that they can save maybe $1,000 or more, they're a lot more liable to change. And so working with your employee base to help them understand, getting them educated about the plans, helping them and assisting them with the tools they need to make the right choice for them, it saves money for the employee overall. And the good thing is that saves money for the company and reduces that likelihood of the Cadillac tax.
Oh, that's good. Well, Kami, it's been great having you on the program again. Always nice to talk to you and catch up. And you're helping employers address a very important area of their business, one that they probably would rather not deal with, but they have to deal with. I'd like to give you an opportunity to leave our audience with a few takeaways, please.
Yeah, sure. I think that the most important thing here is just to remind people that the ACA stuff is challenging. You shouldn't be tackling this yourself. You leave yourself open to fines and penalties, and your CFO is going to be a lot more liable to approve the cost of fixing this problem than they are to look at those hundreds of thousands of dollars of fines. And just to think that this is something that we're all going to have to deal with. I'm sure that when everybody went through the W-2 process, it was just as challenging. But just stay on top of it and be the master of your domain, get in charge.
And if somebody's listening and wants to get in touch with you, how do they connect with you, please?
Yeah, absolutely. They can. The company is Tango Health, and we're at www.tangohealth.com. They can email me directly at KHAYNES@tangohealth.com, or we've got just an info@tangohealth.com email address. They can send a note.
All right. Great, Kami. Listen, enjoyed having you on the program. Have a great weekend, and we'll talk to you again soon.
Thanks again, guys.
Take care.